Hello and welcome, everybody. So excited to have all of you joining us here today. I love seeing familiar names, new names. Absolutely wonderful to have all of you joining us here every Friday on Ask Doc Live. So if you're on live with us, is he here?
Hello.
Yes, you're here. I'm sorry, Doc. I saw a name that I'm like, wait a minute. He's not normally here. But anyways, I hope you are all having a fabulous day. My name is Rebecca Dukes-Kozak, and it is my honor and privilege to be the host of this show that has been running for 2 years and 2 months now. And I'm so excited because with consistency, we're continually feeding into the lives of others information that is empowering and enabling others so that they don't have to be stuck in a system that has been failing so many. Now, on Ask Doc Live, if you are here live with us, we do take questions. Please raise your hand. In the Zoom menu, if you click on that, you'll see something that says reactions. And under reactions, there is the option to raise your hand. Now, we will also be putting information in the chat. So I have my amazing co-hosts with me, Ruth Ellen Sanchez, Nasima Omar, Heather Bowen, Dr. Judy Reynolds, and the webmaster himself, John T. Collier, who makes sure that all of our technical stuff runs smoothly. And I appreciate them so much. And I know you will as well, as they are sharing information in the chat. So make sure that you turn on that chat option if you are here live with us. Now, live with us or watching the recording, if somebody specific shared this recording with you, make sure that you get back with them. Thank them for sharing the information with you. And also say, hey, it really spoke to me what the doctor was talking about. I need to get on board. What do I need to do? They will be able to help you in getting the right protocol for you and ordering in a way that they themselves are receiving that thank you check for sharing this information with you, because this is all about referrals. It's all about helping each other grow as a community in all areas of health. Now, on this program, I do have to make the statement that the statements have not been evaluated by the Food and Drug Administration. The products discussed are not intended to diagnose, treat, cure, or prevent any disease. The information contained on this Zoom is for informational purposes only. And if you are pregnant, nursing, or taking medications, please consult your healthcare professional before starting on any supplementation. Now, the one thing that I love about our program is we use food as medicine. We're taking the things that the good Lord has put on this earth and using it to our body's best use. And to guide us on this journey is a doctor that has been so instrumental in research, both in the animal kingdom and then applying it to the human kingdom, in proving that the genetic theory is incorrect. He is one of the founding fathers of the science of epigenetics. Epigenetics has proven that what we put in our bodies, what we have in our environments, that's what determines what genes are expressed, not the historical stuff. But if there's a mineral deficiency that is passed on through the generations, then yes, it's something that continually shows up, but it's not genetics, folks. It can be modified through what we ourselves do. And this doctor has actually been instrumental in suing the FDA and winning with victories, proving some of the things that he talks about every single day. Now, without further ado, it is my honor and privilege to let you know that this program is sponsored by AskDocLive.com. You thought I was going to say something else, didn't you? With AskDocLive.com, this website is here. It does have a store, but again, get back with the person that shared this program with you if it was shared with you by somebody specific. If not, feel free to use our store on AskDocLive.com. And if you have questions or would like to speak with one of our certified holistic health coaches, use that contact us option. Send us an email and we will get you in contact with somebody that can help you find exactly what is the right protocol to help you reach your health goals. Now, without further ado, it is my honor and privilege to introduce to you, if you are here for the first time, or represent to you if you are here with us and know this man who has been doing this for decades, Dr. Joel Wallach. Dr. Wallach, welcome to Ask Doc Live.
Well, thank you so much, Rebecca, for the kind words and the welcome. Thank you for your entire team, and thank them for their welcome and all the hard work they do. And it's one of those things where it's a never-ending story. It's a never-ending story because living biological individuals and herds and families and so forth, pass on information, which can be life improving and life expanding. And so there's no reason why we can't help everybody add 25 to 50 healthful years to their life just with information.
All right, fantastic. And Dr. Wallach, I know that every single day you are looking at more information and getting an idea of what's going on in the world around us and what are the things that are most important to us. So what today is going to be your topic?
Well, today I thought we'd speak about behavior. We're talking about anger, rage, depression, fear. And many of them have 4 or 5 or 6 or 8 or 10 or 12 or 15 or 20 different causes. And to take one prescription drug for those things from a neurologist or a psychiatrist, this is why, what should I say, they're not always effective completely. You might get a reduction in some of the symptoms of these behaviors and concerns, but it's a little more complex than taking a prescription drug for these behaviors. And so, what should I say? And when the economy begins to tank, and of course, you go back to 1936, the U.S. Department of Agriculture in the USA noted that 1936, U.S. Senate Document 264, there was no longer sufficient amounts of nutritional minerals in our soil to support human life.
So, Dr. Wallach, that was 1936, you said?
Yes.
Okay, so think about it, folks. 1936, what was the population of this area? Has there been considerable growth? And with that considerable growth equals more and more food being produced and more minerals being taken out of this ground, which plants, Dr. Wallach, they can create vitamins, but they can't create their own minerals. Is that correct?
Plants do not create minerals. They do create vitamins. Vitamin A, vitamin C, vitamin D, vitamin K, vitamin E, those kinds of things are all produced by plants. But plants do not create minerals. They only require 3, NPK, nitrogen, phosphorus, potassium. We require a minimum of 60. We require 60 minerals, 60 different minerals for perfect behavior, perfect biology, perfect reproduction, no birth defects, long life, our defenses for our immune system to defend us against bugs. And so if any one of those are missing, you could be impacting 3 or 4 or 5 or 8 or 10 or 12 different things.
And you have done so many autopsies, which one autopsy creates thousands of different data points that you look at in regards to the tissue and what's going on, the vitamins, the mineral composition, of what you're looking at, the disease that's also present, and doing those correlations.
That's correct. And so the important part here is, Rebecca, is you don't want to wait until you're being autopsied to figure that out. It's a little bit, too late. And so what you want to be doing is dealing with this before conception. So we can eliminate all birth defects, because there's no birth defects that are genetic or autoimmune. All birth defects are caused by nutritional deficiency to the developing embryo. And if the young women and young men who are in the fertility age, and even if they're not sexually active, you never know what happens after a long party, right? And they're all drinking wine and so forth. Who knows? And so everybody needs to be taking the 90 essential nutrients, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. And then if a pregnancy does occur, the odds of having a baby with a birth defect like cleft palate, spina bifida, Down syndrome, missing legs and limbs and toes and fingers, those kinds of things, will not happen. Those things happen when the mother and the father are missing nutrients, and so the embryo doesn't get complete information. Okay, so we have a huge responsibility for the future generations of making sure we're getting all this stuff, which means you consciously have to deal with it. Now, this got worse at 3 o'clock in the afternoon, Monday, September 4th, 1882. At 3 o'clock in the afternoon, Monday, September 4th, 1882, on Pearl Street in New York City, in the bluff overlooking the construction of Brooklyn Bridge, Thomas Edison pulled the switch in the first commercial electric generating plant and created what we call Hell's Kitchen, which is named after the terrible district in New York City, which all bad things happen. Well, for thousands and thousands and thousands of years before he pulled that switch, okay, and gave us electricity, we were using wood and coal as, there you go, wood and coal as fuel. And we were putting the wood ashes, which are 98% minerals, and coal ashes, which are 98% minerals and only 3% carbon, into our gardens, and the carrots and the beans and the peas and squash and tomatoes and so forth and corn would pull up all these minerals, and people got them. Also, grandma was putting wood ashes and coal ashes into our food as a spice, and we were getting minerals that way directly through putting the ashes into our food every day, into our soup and our stew, and on our mashed potatoes and on our green salads and so forth. We didn't have commercial salad dressings and oils and all that kind of stuff back then. We were using wood ashes and coal ashes. When we went to electricity, thank you, Thomas Edison, it was a great thing for industry and society and so forth on one hand, but also there came a negative with it, because when you have electricity, we weren't getting the coal and the wood ashes anymore. Suddenly now we didn't have all these nutrients, and about 45 new diseases occurred almost overnight. And everybody's saying, these are genetic. That's because it was the new darling of the medical system, was genetics. And if they didn't understand something, they immediately just turned around and said, well, it's genetic. There's not much you can do about it. Okay. And it was actually false information. And it was all due to switching from wood and coal as fuel to electricity. We had been using wood and coal for fuel for thousands and thousands and thousands and thousands of years. And then suddenly it all went away, and nobody made any adjustments for losing that source of minerals. Okay, so that's where we got in trouble. Well, getting onto the subject of today, I want everybody to get a hold of the book, Rare Earths Forbidden Cures. Switch over to Rare Earths Forbidden Cures. Okay, do you have that?
I do.
Okay, there you go. Now, Rare Earths Forbidden Cures goes into these nutrients that prevent all these horrible events from happening. Okay. And it's one of those things where people were coming to me with all these problems. And so that's why the book was written, because I'm getting swamped with all these babies being born with all these problems, infertility, people dying of quote, old age when they're 30, 40 years old, developing all these diseases we've never seen before. What is going on here? Well, these were all nutritional deficiencies created again by switching over to electricity. Now, nutritional minerals naturally do not occur in a uniform blanket around the crust of the earth. They occur in veins like gold and silver. So some areas might have only 3 minerals, or 2, or 1, or none. And some areas might have 6, and some areas might have 7, and some might have 8, and some might have 12, and some might have 22, and some might have 30, and some might have 35, and some might have 40. And so that's why there's people and places on Earth, usually where there's volcanoes and volcanic ashes loaded with these minerals, usually islands. They're surrounded by all the algae and plankton and seaweed and stuff that grows in the oceans. And so they eat a lot of that stuff, and they're getting all these minerals from the ocean. Okay, that's why the Queen, who just died at 96, the Queen of England, I went back and I spent 3 hours going through her daily diets. 2 or 3 meals every day was fish, and she was eating seaweed mixed in with her salads, plant minerals, plant minerals, plant minerals. And that's why she lived to be 96. It wasn't because of good medical doctors in England, because she didn't see medical doctors, okay, because she was so healthy. The longest living of all the royalty in England, 96. Yeah, her mother died at 100, but she was not a queen as long as Queen Elizabeth. And so her personal diet makes sense. Okay, her personal diet makes sense. Now, and of course, now and today we have all these problems we're going to talk about today. We're talking about and they're listed in this book, okay, Rare Earths and Cures. And the book gives you a way to determine which of these nutrients you're missing. It's called a hair analysis. And I went back yesterday. Again, I spent a lot of time going through hair analyses. And I'm looking, there's 3 charts. There's 3 charts when you get a hair analysis back. And of course, the book, chapter 10, 11, page 272, where it starts, it'll tell you how to collect the hair, how to package it, where to ship it, how to do all that. And within a couple of weeks, you're going to get this test results back. And you get, there are 60 essential minerals, okay? And there's a chart for the 60 essential minerals that tells you where you're at. If they're all missing, if they're all below the bottom line, that means you're not absorbing, you're eating gluten and your intestines are dead, you cannot absorb nutrition, and that's why you have all your problems, okay? And then sometimes you'll see the minerals in the nutritional area, you'll see they'll be scattered all over the place. And so you know which ones to add more to, okay? In some cases, you just want to add our plant minerals, which has 78 minerals, and get them all, okay? And then, of course, also, there's some very interesting stuff in one little chart, which I'm not going to name because I don't want people to run to the store and buy that one nutrient. But you'll see it immediately. It'll make sense to you. Okay. And it's about 3 of those minerals in that second nutritional chart are, what should I say, if you're deficient in them, they will create all kinds of emotional problems. Now, this goes back, they first recognized this in the year 400. In the year 400, okay, people were using, let's see here, they were using ground up rocks, from certain rocks, usually around where they had volcanoes and stuff like that. Okay, so you're talking about lava and so on. And they would grind that up and give it to people who were crazy, and they got uncrazy by giving them these rocks. We're talking 400 years ago. And then, you know, when we were able to decipher what was in those rocks, people would what should I say, fractionate it and go for certain elements. And it became popular to use those elements to get rid of fear and confusion, depression, anxiety, all these kind of things. But we're talking about 60 different minerals, okay, any one of which can cause these problems. And if you're deficient in 3 of them, 5 of them, 8 of them, 12 of them, 20 of them, you're in big trouble. And taking one drug from a prescription from a doctor to abate these symptoms, you might get some benefit, you know, and behavioral relief, but there's still probably 20 others you're not getting benefit for from taking that prescription. You really, really, really need these 90 essential nutrients. And then, of course, the third list, which everybody should be familiar with, is toxic minerals. We're talking about mercury and lead and uranium and others. And it lists them and tells you if you have them in you, okay? And it tells you whether they're, you know, at clinical levels or not. It's a very, very good chart for toxic minerals. And so everybody should be doing, especially if they're working in factories, if they're working in a hospital, if they are working, with the soil, with mines and so forth, they're, digging and farmers out in the soil and so forth. They need to be getting a hair analysis once a year. Okay, if you're in the military, and I get this all the time. People say, yeah, I was in the military for 20 years before I retired, and I just have all these problems. And I know it's due to all the weapons we had and all the chemistry we did in war, war, ammunition and so forth, and getting all these chemicals. And that's my problem. So we do a hair analysis on them, and they didn't have any bad minerals in them. They were just deficient in these nutrients. We gave them the nutrients, and in 2 to 6 weeks' time, they were perfectly normal after 25 years of suffering and falsely believing they're getting all these bad minerals from weapons in the military. And so is it worth getting a hair analysis once a year? Of course it is, because you'll add 25 to 50 healthy years of your life if you do that, because you'll know exactly, you'll know exactly what to do to get rid of all these horrible, horrible symptoms. You see this in the newspaper every day, where these kids are 16, 18 years old, they're 12 years old, and they pick up a gun and they go to a hospital and start shooting up people, or they'll go to a school and start shooting up people, or they go to a mall and start shooting up people. Well, why did they do that? Well, that's because they were deficient in these nutrients, and they had no control over their emotions, and they were just following what their emotions told them to do, but it was based on a false health. Okay, it was based on a false health. And so we can eliminate all that kind of thing by doing the hair analysis every year. When you start, get that hair analysis done. And of course, we can help you read it, but it's very, which I say, get that book, Rare Earths and Cures. It'll tell you how to read it properly. That was really a great publication, and it will help so many people. Rare Earths and Cures. What a present to give to somebody. Get them on the Longevity program, give them the book, Rare Earths and Cures, give them the book, Hell's Kitchen, so they know the story of the switch from wood and coal to electricity and why we have these problems. It didn't just happen. We did it to ourselves because we didn't say, okay, now what are we giving up here when we're going to electricity? What are we giving up? Are we giving up anything we need to keep? And nobody said anything about that. And everybody was just so glad to get electricity and get rid of all the soot and the smoke and so forth. And they forgot that there was good things coming out of the wood and the coal, which were the ashes, which we were getting our mineral source from. Over to you, Rebecca.
All right. Well, thank you so much, Dr. Wallach, for that information. And, you said we did it to ourselves. Well, guess what, folks? It's easier to undo. And Dr. Wallach and his formulations have made it easy to undo. And the only reason why I can say that is because I did it. And I can't make any health claims or anything like that. But at 51 years old, I feel younger now than I did in my 20s. And I actually have less pain than I did when I was 16 looking at knee surgery. So I am so thankful that I found Dr. Wallach and pulled that trigger. It's like, okay, I had tried everything else, even other nutritional programs, and nothing seemed to help. And then I'm like, okay, we'll try this, because I was desperate. Dr. Wallach, I had severe depression.
Well, let me say something right there. Okay, if you have depression, if you have anxiety, if you have aggression, any of these things that are tied to emotions, okay, you want to inflict injury on yourself and others and so on. You want to get a hold, again, of that book, Rare Earths and Cures, get that hair analysis done, and it's going to be magic. It will be magic. Now, I also want you to get our plant minerals with 78 minerals in them. You get the Rebound, our sports drink, with 100 nutrients, 75 minerals, and 25 vitamins and amino acids. And you go down that list, okay? And some of these minerals were used as individual minerals 400 years ago, because people recognized it 400 years ago that one mineral took care of all these craziness problems. Before psychiatrists, one mineral, okay? And you look down through it when you read the book, you'll know which ones to look for. And whoop, there it is. It's in every one of these mineral combinations. That's why I'm such a nice guy, because I take all these minerals, including those dozens there's several dozen minerals that are involved in these, and there's in every one of them there's overlap, because if you're deficient in any one of them, you get depression. If you're deficient in 3, 4, 5, 6, 8, 10, 12, 20 of them, you get really a complex mix of depression and anxiety, and suicidal behavior and aggression, anger, all that kind of stuff, because you're getting the deficiency symptoms of 3, 4, 5, 6 different diseases, some of which overlap a lot. Okay. And so when you see these nutrients, and I always hesitate, you rarely hear me talk about a particular nutrient, because people will run to the store, they'll buy that one nutrient and they take it and their symptoms abate a little bit or totally. But then 3 months later, they die because they're missing the other 89. Okay. And so I rarely give out the one, because it's rarely the one. It's usually what's the word I'm looking for? Okay. A rainbow of these minerals that are contributing to your problems, especially if they're emotional. Oh my gosh. Okay.
Well, and then Dr. Wallach, the pharmaceuticals that I was on for depression were making me more like a zombie. I mean, and
they were chemically shutting off all your switches.
They were chemically shutting off switches. They didn't make me happy. They didn't make me, or didn't even help me enjoy life. They kind of dulled the emotion of the anger and wanting to hurt somebody. Didn't matter who it was, but it didn't. And then it just didn't. The side effects were almost as bad as what I was taking it for. And that's so true with so many of the pharmaceuticals that I personally have been on, where it's because of the FDA, I cannot mention a lot of stuff, but folks, health is simple and we are empowered individuals. I am so thankful for the science of epigenetics that has proven all of these things that my mom and her sisters and my grandparents experienced do not have to be my experience, because I have changed the way that I eat. Yes, there's recipes that have been handed down that I just absolutely love, but I've been able to modify those so that they are abiding by Dr. Wallach's good foods, bad foods list. I can enjoy the taste. I can enjoy that comfort of something that's been passed down without harming my body because of the ingredients.
Yeah, and let me throw something in here at that point. We have so many different forms. We have the liquids, which you don't want to carry a quart of liquid in your back pocket, in your workday and so forth. And so we do have our synaptive, okay, which is becoming legendary in just a couple of years. You have synaptive. Oh my gosh, people love it because it does have most of these things from sea sources, most of these things, again, from rocks and ash sources. So we're getting two different sources in synaptive. And then we have the mineral sticks, which is our plant minerals. Instead of the liquid, we've gotten rid of the liquid out of there. And we have these, I think it's 30 sticks in the box of mineral sticks. Okay. And the mineral sticks have 75, 78 minerals in them, plus collagen, plus cherry extract. So even little kids like them. So if you have a kid who's getting a little rank and crazy, get them on the mineral sticks. He'll love them, or she'll love them. And they'll just, in a week or two, 10 days, they'll turn right around. Same way with the Rebound powder, same way with the Rebound can. If you're going to use the can, you got to pop the tops at night, put them in the refrigerator so they off-gas the carbonation at night, and they'll be flat in the morning. I drink a half a can with breakfast, but I pop the top the night before. Okay. And then, of course, we have herbs also, which is called Soul. Okay. Half a dozen herbs, which kind of act like drugs. Okay. The herbs act like drugs. They don't actually give you the nutrients your body's looking for, but they can contribute to reducing the symptoms without having to get a prescription from a doctor and so forth. Okay. It's called Soul. And then we have, for kids, the kids' toddy. I just love the kids' toddy for kids. Tastes good. It tastes like cherries and lemonade and cherry juice and so forth. And it has, it's a meal replacer. Okay. And even if the mother's breastfeeding, one meal a day for the baby can be a kid's toddy. Don't forget to put in the cherry mints for all those other minerals. When you read the label, you'll see why. But the minerals that are in there, it'll blow your mind. And then don't forget the EFAs.
And the EFAs,
there you go. Yeah, so the
EFAs. EFA, so Dr. Wallach, I have EFA plus, and I have ultimate EFA.
Okay, well, EFAs are the straight essential fatty acids, okay, which are necessary for good behavior and good blood issues so you don't get blood clots and so forth. The EFA pluses come from a different source. Okay, the EFA come from seeds, not gluten seeds, gluten-free seeds, but the EFA pluses come from fish livers, like the Queen of England. That's what she was eating. That's why she lived to be 96. Okay, so I take 3 of the EFA pluses twice a day, and I take 3 of the EFAs twice a day. So I'm covering the waterfront, as they say.
I think I'd rather have my fish liver in this soft gel capsule than.
Yeah, if you're only going to take 1, I would go with the EFA pluses.
All right. Well, Dr. Wallach, thank you so much for all that information. I know we have some hands that are raised. We have some questions in the chat as well. And, you know, especially in times like this, there's so many things going on that create stress. And our brains need that nutritional support to be able to best handle stress. When your brain is deficient, that ability to handle stress is going to be deficient as well. So I really encourage you, from my own personal experience, to experience the difference. Yes, there's the mineral sticks. Oh, and I wanted to mention, so just kind of a warning, usually whenever you get a pouch, you only have like this much in the bottom of a 6-inch pouch. This thing's full. So when you open it, be very careful. You're going to get powder. You might get a little bit of powder on your hand, but it tastes great just as powder. So just kind of what is that? A public service announcement that you're getting a lot for your money and it tastes really good, just as straight powder. So I'm glad you have the mineral sticks there, because I don't have them here. They're in another room, but I absolutely love them just as the powder, Dr. Wallach, and I can sprinkle them over my yogurt.
You can put, you know, they're the sticks, or the diameter is less than that of a ballpoint pen, and they're about 3 or 4 inches long. And you can put a handful of them in your pocket, you know, or your purse or your briefcase. They're very light, and just, you know, take a fingernail clipper or a little cuticle scissors or something with you, or just tear it. If you tear the top off, you're going to lose some. So I like to have something that'll snip the top off.
And something that we didn't mention, those mineral sticks also include collagen.
That's true.
Collagen is very important for what, Dr. Wallach?
Well, cartilage, ligaments, tendons, connective tissue, bone marrow, skin, artery walls, vein walls, the membranes covering your brain, your eyes, your nerves. It's so important.
Intestinal wall.
Intestinal walls, yep.
If you're having intestinal issues, stomach issues, they tell you that you've got, you know, holes in the lining of your stomach, whatever, collagen is your friend.
Yeah. And how do you find out if you have everything you need?
You do a hair analysis. There you go.
Rare earths have been cures.
All right. And so to find Dr. Wallach's books, you can go to askdoclive.com. There is a section there that you can click on that will take you right to his most popular books. So, and we're going to be expanding that here shortly so that all of his publications will be available right there. So I'm super excited about that as well. Lots of neat and amazing things going on that we're excited and honored to be able to share with you, because it's giving you information that's affordable, that's attainable, and that you can implement yourself right at home without a prescription and without waiting for a doctor's appointment. With that being said,
well
I had
said.
my little disclaimer in the beginning, but I love using food as medicine. So Dr. Wallach, let's go ahead and go to the first hand that is up today.
Okay.
And Miriam, go ahead and unmute yourself. How are you today?
I'm doing well, Becca. Thank you. Thank you, Dr. Wallach, for taking the call.
Where are you from, Miriam?
Hello. I am calling for my father, who will be 89 next month. He is 150 pounds and 5 feet 9 inches tall. And I actually have 2 questions if we have time. One of them is, he's been on the supplements for a year, and he's experienced great improvement in his knee pain and in the numbness in his left arm. So he's very happy about that. But recently he developed pain that started in his waist and radiated down to his left leg. And it goes away when he lies down. And last week he was diagnosed with sciatica. So I am calling to ask you what you would recommend to help him.
Well, yeah, this is very, very typical. Okay. This is happening upstream. He has osteoporosis of the skull. He has had some benefit in relieving the symptoms of osteoporosis of the skull. He could be having a squeezing of the spinal cord as it's coming out of the back of the skull. If you don't have it, you need to get a hold of the book on the CD set. It's all in your head. Covers 37 different diseases, including sciatica. Okay. And sciatica can emanate from any place down the line, from the skull, you know, everywhere there's a vertebrae, down to the bottom of the tailbone, and give you symptoms down in the legs and toes and so forth. That's called peripheral neuropathies. Okay, so the actual impingement or damage or wound is higher up, but you're getting the symptom lower down the line. Okay, and let's see here. So what I would do for him at 150 pounds, and of course you're probably doing a lot of this already, but for other listeners, at 150 pounds, you got to get rid of all the bad foods: no fried foods, no processed meats, no oils, no glutens, no wheat, no bar, rye, oats, no sugar, no carbonated drinks. Even the diet ones got to go, because carbonation neutralizes stomach acid. And you cannot absorb minerals or digest food without stomach acid. The good Lord gave us stomach acid for a purpose, okay? And then you also want to take 2 healthy brain and heart packs a month, 2 full doses a day, 2 healthy brain and heart packs a month. There's 215 nutrients in the healthy brain and heart pack, the core of which is the 90 essential nutrients, the healthy start pack. And I only weigh 142, but I take 2 of those per month for 2 doses a day. Then also you need 2 bottles a month of our MSM. So you can take 3 at breakfast, 3 at lunch, 3 at dinner time. So he can support maintenance repair of his cartilage and ligaments and tendons and connective tissue from his skull, every vertebrae, every disc between the vertebrae, all the way down to his tailbone and below. Then he needs the collagen peptides. I'd go ahead, a scoop of that in his morning drink and a scoop of that in his evening drink. There's collagen from fish, poultry, sheep, and beef. Very, very great product. And then also vitamin D3. Vitamin D3, take 3 of those twice a day. It's 2 bottles a month. Okay. And let's see here. I would also throw in some interesting stuff. I would throw in something like even synaptive. Let the brain start working and do more from the brain standpoint to work on things inside the skull and in the spinal cord. Don't forget 3 eggs twice a day with soft yolks, not hard boiled. Okay, they have to be soft boiled, soft yolks, soft poached, soft yolks, soft scrambled in butter, because 25%, most people, Miriam, don't know this, but 25% of the brain weight is cholesterol. 25% of your spinal cord weight is cholesterol. And so cholesterol is an enormous essential part of messaging, okay, because it forms the white matter of the brain. And so when people say, oh yeah, I'm losing the white matter of my brain, okay, and so my brain is shrinking, I'm losing the white matter of my brain. Well, are you on statin drugs? Well, yeah, my doctor gave me a prescription on statin drugs a couple of years ago. Well, that's why your brain is shrinking. Are Or eating eggs. Oh no, I can't have eggs because of all the cholesterol. Well, that's why your brain is shrinking. Okay, you need to go back to eating the eggs and get off the statin drugs because cholesterol is not what plugs your arteries. That whole concept was entered into because the medical system falsely believed that plaque in the arteries is due to cholesterol consumption. No, it was due to consumption of oils, heating oils, cooking oils, frying oils, all that kind of stuff, and avoiding eggs and animal fat. Doctors said, "Oh, just avoid animal fat and eat more whole grains. All the problems go away." Well, that's when we started getting everybody was obese. And we went to just eating grain like feeder cattle, and on a farm. Oh, you feed them grain, they get fat, and you can put them down in the market. So if you just want to eat grain, you're going to get fat and go to market, which is the medical office.
Great. And then I actually had a second question, if you have time. He has lost 10 pounds over the last few years, and he would like to gain about 5 to 10 pounds. What do you recommend? Is there certain foods he should be eating in addition to what you just mentioned?
Yeah, of course, making sure he's getting, all his nutrients. But then if he wants to gain 10 pounds, he needs to eat some more carbohydrates, okay? I eat 2 scoops of rice. I prefer the wild rice. Okay, I like wild rice with 2 meals a day, and it helps me keep my weight up. Okay, the rice. You can have corn, not fried corn. Okay, but corn on the cob is good. And I like people now because of all this supply chain problem we're having. I want everybody to start getting cans of lima beans, peas, those kinds of things, and keeping, a dozen of those cans around all the time, because if you can't get fresh food at the market for a month, you have those cans, okay? And you just want to make sure they're packed in water. You don't want them packed in oil. You want them packed in water, okay? Peas and beans and so on. And, we keep about a 3-month supply here at the house. So if the supply chain goes away, we're okay for 3 months. So we figure, we can grow our own in 3 months if we have to.
Great. Thank you so much.
Well, thank you. Keep us informed. Call us every couple of weeks. Let us know how Dad is doing. Okay, Miriam?
Okay, I will. Thank you.
You bet.
All right. Thank you, Miriam. So let's talk a little bit, Dr. Wallach, about the canned foods, because there's a lot of canned foods out there, folks, that are inferior and have things added to them to make them taste good, where if you're getting a good quality, you don't have to have that sugar added to your vegetables to make them taste good. So really read your labels and make sure that you're getting a good quality food. No, it's not going to have all the minerals. So I keep 6 months of my supplements on hand at all times, and I rotate them.
Which one of the liquid minerals do you like?
Which of the liquid minerals?
Mm-hmm.
Well, I take the plain plant-derived minerals and I mix them with Z-Radical.
Mm-hmm.
So I do an ounce of the plain plant-derived minerals. I do 2 ounces of Z-Radical, but then
it looks like red wine.
It's a little cloudy, but that's the sulfates that are keeping it from being cloudy, and I'm okay with that. I don't want those. But I also will take like the mineral sticks. I'll put them in my electrofuel. I'll put them in my Core AO, which are our hydration sticks that we offer that help with additional nutrients throughout the body to help support good cell structure, good mental clarity. I mean, there's so many different things that we can do using vitamins, minerals, herbs, the natural things without having to rely on a chemical to alter our mind. Why don't we just give our bodies what it's starving for so that it can function optimally in a more natural way? So
sounds like a plan.
Yeah. And I mean, through all of my research, trying to find protein in a can, I mean, beef, 14-ounce can of beef for $15, that's a little steep, you know, when you're looking at stocking up. But beans, kidney beans, black beans, you know, they have a protein in them. It's not a direct it's not a direct substitute for meat, but I mean, that is giving you some protein.
Don't forget the eggs.
And eggs. So yeah, fresh eggs, you can still get eggs in a powder form that are organic that then you can use. I know we like to say, don't overcook your eggs. You don't want to kill that cholesterol. You don't want to kill those enzymes that are so beneficial in the eggs. So Dr. Wallach, I'm going to do a video on creating the perfect soft-boiled egg.
Okay, just think about it. That egg has a whole chick in it. That egg has a whole chicken in there. 26 days of incubation, a whole chick comes out of that egg. Isn't that amazing? With a heart and a liver and lungs and kidneys and skin and salivary glands and stomach and intestines and brain and eyes and feathers and muscles and tendons and bones, all from that one egg.
From that one egg. And depending on the breed, you can go from hatch to ready to put on the table in 3 months, 5 months for others. It's like those cells they have everything that they need to produce and be strong, be healthy. But it also goes into what food they're eating also. So
that's correct.
Dr. Wallach, tell us a little bit about, you have a book called Prepare, the Prepper's Survival Bible. Tell us a little bit about this book.
Okay, well, Prepare, as the name implies, encourage you to do home storage of foods and drinks and things that you need, spices and so on, and all these nutrients we're talking about, so everybody will be nice and not be mean and evil and have, you know, suicidal tendencies and all this kind of stuff. So you need to have all the good stuff. I like to say, realistically, a 2 to 3 month supply, better yet, a 3 month supply. And that book right now is flying off the shelf, okay, because it encourages people to do all the right stuff. And, you know, we keep, when it comes to eggs, we keep a 2 to 3 month supply of eggs in the refrigerator, okay? And it's one of those things where we have 3 eggs for breakfast every morning and 3 eggs at evening, okay? And you got to make sure you're getting all the nutrients, okay? And so this book tells you. And one of the big things that used to be, of course, was salt. And that's how people got into the nutritional supplementation industry, was people on the coast, they would just boil water, seawater, and the salt. They could take it inland and sell it for great amounts of money because people would go crazy for that salt. And they knew that salt made them healthier. They knew that salt gave them strength and stamina. They knew that salt made them live longer. They knew that salt helped them digest their food, because sodium chloride is raw materials. And there I didn't want to say different minerals, but sodium chloride and salt is required for digestion. Okay, stomach acid is made from salt, sodium chloride. And so you can't even digest your food without salt. So people who say, oh, my doctor says I can't have salt because I'll get edema. Well, you need to change doctors. Salt was the first nutritional supplements ever. And of course, Prepare goes into so many different directions that you can do without refrigeration, okay? Because if the electricity goes out, then what do you do, okay? So we have stuff that you can put in the refrigerator. We have stuff that you can have on your shelf for 10 years and it'll still be good. And it's all in the book, Prepare. And you notice I'm in my military uniform. I spent, let's see here. Yeah, I spent 7 years in the Army at Fort Leonard Wood, okay, in the artillery, 105s, 155 howitzers artillery. And then 20 years in the Air Force. My base was in Alaska. I don't know, I went to about 30 different countries through the Air Force. And so that taught me how to prepare. And so I wanted to share that with so many people. And that's where that book concept came from.
Well, and this book is co-authored yourself, Dr. Milan, who is a lieutenant with the Chinese Air Force as
That's
a
correct.
general surgeon and microsurgeon, and also Marvin Brock, who was a Navy
SEAL.
Mm-hmm. So we're taking information from people that have, gone through some pretty drastic things, and helping us be able to not have to stress. It goes back to stress, folks. If we're prepared, it reduces the stress on our minds, on our bodies. So
well said.
So I like that book as well. Let's go to the next hand that is up, Dr. Wallach, and James. James, go ahead and unmute yourself.
Well, one thing there, Rebecca, that's the motto of the Boy Scouts: be prepared.
That's right.
Okay, we're going to whom?
James.
James.
James, can you unmute yourself, please? There you go.
Hear me okay?
Yep. Yes, sir.
Okay, Doc. I'm calling to report in again. I first talked to you on July 8th about an arm injury I had where I supposedly tore something in my right bicep, leaving me with a Popeye muscle, it's been referred to, and it was quite painful, especially at night, trying to sleep on it, doing anything laterally with the arm, like cleaning a sink or something. And so you gave me a prescription here, and I've been following it ever since. And boy, getting fantastic improvement. It's 90, 95, 98% cured as far as the pain goes. My first question is, how do I know when I'm done? If I continue to take this and the pain completely stops, is that all I'm expecting from this?
Okay,
or
well here's, I'll let you answer this question yourself, but I'll ask you two questions, which will allow you to answer the question you're asking me. Okay. James, how long do you need oxygen?
The rest of my life.
Okay. James, how long do you need water?
The rest of my life.
James, how long do you need the 90 essential nutrients?
The rest of my life.
There you go. So that answers that question. Now, if you're using a therapeutic dose, which might be 3 times, 5 times the dose, what you want to do is get a hair analysis and see where you're at. Okay, get a hair analysis. You've been taking this since June. Get a hair analysis. Get the book, Rare Earths and Cures, page 272, chapters 10 and 11. It'll tell you how to clip the hair, how to box it, where to ship it. Don't forget to put the check in there because they won't run the test. You can send a check or a money order, either one. And then we can reevaluate and say, okay, there's some of these you're a little low in. Most of these you're doing good, because we don't know what percentage of those nutrients you're absorbing. Certainly you're getting clinical benefit that you're recognizing without a doctor having to tell you it's getting better. You know there's an improvement. And so let's see what the tests say, okay, before we start reducing things, okay?
Okay, my question is now is it reasonable for me to expect that this Popeye muscle will go back to looking like the other muscle on the other arm? Or
well, I would have to see either the scan of that muscle and the joint, or where the tendon plugs in, or a written report from a doctor, an orthopedist, telling us what's going on there, and then I could answer that question more clearly. Because if the tendon is totally torn off the bone, the obvious thing is you're not going to get rid of that Popeye muscle. Okay. But if the tendon is still there, the answer is yes, we can get rid of it.
Okay. All right. Also, the only negative thing I've experienced from the time I started was about maybe after a month of taking the full dose of all this stuff, or actually double doses, I started having loose stools. Am I taking too much of something, or get over it, or what?
Okay, well, what you can do is try and divide up and instead of taking it all at once, try and divide it up so you're taking it twice a day, once, half in the morning, half at night kind of thing. See if that
That's
helps.
what I'm doing. That's what I'm doing.
Okay, good. Okay, then make it a third, and a third instead of half and half, and see if that helps.
Okay.
But before we reduce anything, let's see what the hair analysis says.
Okay.
Okay.
All right. And then
rare spin cures.
Recently, the collagen peptides are back ordered from Longevity. I haven't been able to get it for over a month, and they just notified me yesterday that it's still on back order. So that I was at least getting some, I shopped around and found other products, but none of them really have all the stuff that the Longevities do, even the stuff that's labeled for joint support. Mm-hmm. So I'm not sure what.
Okay, well, for joint support, what you want to do again is get the go ahead. We have so many different products with the collagen in it, including hair, skin, and nails. There's collagen in that.
I was taking that too. Yeah.
Yeah. Okay, and we do have the mineral sticks. There's collagen in there, mineral sticks. Okay, and so kind of think in those terms.
The plain collagen is not on back order.
Well, there you go.
That's
the joint health,
for hair and
joint
nails.
health is, but the plain collagen is not.
Yeah. So I was wondering if I can only get the plain collagen. Is there something else I should take to beef it up?
Mineral sticks.
Mineral sticks. Okay.
Yep.
All right.
Okay, then, keep in touch with us. Don't wait so long. Call us in 2 weeks and 4 weeks and 6 weeks and let us know what's going on. And, but that's why we have 5,000 products, because we knew from the very beginning that there's going to be times when there's going to be shortages and we would be missing something. So that's why we have sort of 5 or 10 or 15 or 20 different directions to provide certain things so that you're not dependent on just one. Okay.
Okay. And I had also called you a couple of weeks after the first call about a trigger finger I had on my left hand, and that's pretty much completely gone away.
Well, the trigger finger is part of a peripheral neuropathy. The brain was squeezing, the skull was squeezing the spinal cord, and the spinal cord was showing you that part of the spinal cord that controlled that index finger, the trigger finger, was being squeezed. And so once that was resolved, the trigger finger went away.
Yeah. Well, we're definitely happy with the results on this end, Doc. So thank you very much.
Well, thank you so much for sharing. When you give testimony like that, it gives people hope that they do have ways of improving their health. Thank you so much. Thank you. Thank you, James.
Thanks, Doc. Bye-bye.
Thank you, James. Bye. And another product that helps that's available for joint health is our Pro Joint. Pro Joint includes nutrients that help in supporting connective tissue and muscles as well. So
okay, great. Thank you.
Yeah. I love the fact that we have options, Dr. Wallach. Well, it is 2 minutes till the top of the hour. Do we want to take a break now or go to the next hand that's up?
Let's see if we have somebody who's been waiting with their hand up. Let's go to that before we take the break.
Okay. See, I love how you put people first, Dr. Wallach. Let's go to Rhonda, who has her hand up. Rhonda, go ahead and unmute yourself. You're on live with Dr. Wallach.
Hello.
Hi. Where are you from, Rhonda?
I am from Virginia, Blue Ridge, Southwest Virginia.
Okay.
I am on Rebecca's team. I'm a patient of yours, and I've been using your products a couple years now, and I'm also a distributor.
So you're family.
I am, and I'm so happy to be part of this healthy, wonderful family. You're, in my opinion, the best doctor in the world that I know of. So
you're very gracious.
I love this show that you and Rebecca do. Y'all are an awesome team, and her health story is inspiring.
Beautiful? And we'll give all the credit to the Lord, but Rebecca has really an inspiring story.
She does. So that's why I'm here. And I've never had any health issues, but I'm currently just been made aware of one. So I have a question for myself, and then I have a couple questions for my customers, if you have time to hit those real quick.
Okay, let's hit it.
All right. My question is, recently I have a horseshoe kidney. I've had a couple of kidney stones over the years. I'm actually 61 years old. I weigh about 140 pounds. I'm currently using the 90 cardio beats, minerals, and a few other things. But I have a horseshoe kidney, and I recently was sick. I think it was food poisoning. And they told me that I have a large cyst on my kidney, or a cyst that I need to look into. I've just had a real brief, heads up, you need to check this out. And then a lesion on my liver. So
okay, by a lesion, what are we talking about in the liver lesion? What does that mean?
I don't know. I need to look into it more. I had a CAT scan done in the ER. So I have to follow up on that, which I'm doing next Friday.
Okay.
So maybe I should wait on that.
Okay. And you weigh 140 pounds. And so again, for our listeners, because you probably already know what to do, but I would get rid of all the bad stuff. No fried food, no processed meats, no oils, no gluten, no wheat, bread, rhinos, no sugar, no carbonated drinks. Even the diet ones need to go. I would get the book Rare Earths Been Cures if you don't have it, and get a hair analysis done. Okay, because when you have kidney stones, it means kidney stones mean that you're pulling calcium out of your bones for some reason. Okay, your parathyroids are doing that. And so you're getting a precipitation of some of that extra calcium in your kidneys as kidney stones. You're not eating too much calcium. That doesn't come from eating too much calcium. It comes from your parathyroids pulling minerals out of your bones, okay? And so do you have white, gray, or silver hair? Do you color your hair?
Yes, I do.
Okay. All right.
I think I got that earlier in life. So,
when you were 10 years old or 12 years old or 20 years old?
No, probably like 40s. I don't remember exactly, but it wasn't later in life.
Okay. When you have loss of hair color, that's due to a mineral deficiency. That's not an aging thing, due to a mineral deficiency. And so the hair analysis is going to give us a lot of information. So let's get a hair analysis, okay?
Okay.
And then as soon as you get the results back of the hair analysis, then get back to us and we'll walk you through this. But again, the book, Rare Earths Been Cures, chapters 10 and 11, it starts at page 272. It'll tell you how to collect the hair, how to package it. Don't forget to put the check or money order in there. Okay.
Okay.
All right. Thank you, Rhonda.
Okay, great. If there's time, can I come back later and ask a couple more questions after break if there is time?
Yes.
Absolutely.
Awesome. Thank you, Dr. Wallach.
Thank you. Thank you. Thank you.
You're awesome. Love you very much.
Well, love you too, dear.
All right.
We love all the Rhondas.
Let's go ahead and take a break, Dr. Wallach.
Okay, dear. Thank you.
All right. You're welcome. And thank you, everybody, for being here with us. We have so many questions in the chat. Ronette, we're going to get to your question. CJ, we're going to get to your question. We have hands up. Anne and John. And I think I had another John and Vaughn with hands up, and Rhonda. So excited to have everybody on with us here for Ask Doc Live. You have been listening to AskDocLive.com, where we do have a website available that if you have never spoken to anybody before about longevity and nobody shared this video with you, you found it on your own or through our newsletter, you are more than welcome to go to AskDocLive.com. And we have a store there. We have Dr. Wallach's books there. We have a contact us. If you would like to get in contact with us and you would like a personal consultation with a certified holistic health coach, and in some cases, we make sure that we get connected with Dr. Wallach because he is our authority in this. We want to make sure that you are getting the proper information, even though our certified holistic health coaches have been trained in what he teaches, we still have him available to us. And I absolutely love that. So that is through the contact us on our website at AskDocLive.com. We will be right back after a short break. Don't go away. Get up, stretch, make sure you get your hydration, and we will be right back. All right. Thank you, everybody, for sticking here with us. Again, you are watching Ask Doc Live, And this is being brought to you by AskDocLive.com. If somebody shared this video with you or invited you to our live presentation, get back with them. Thank them for inviting you to watch and gain information. I hope you're being a sponge, because as we're collecting information, as we're going through life, there's going to be times where we can squeeze that sponge just a little bit and share information with other people that can make a huge impact in their lives. Whether we're doing it just as a friend, whether we're doing it as a business, you know, there's no greater joy than doing something that is positively affecting somebody else in their life. And we encourage you to, one, if you have not experienced it yourself, give us a shot. Give us a try. Give us 90 days. Dr. Wallach says, give us 90 days with the 90 essential nutrients before you make any drastic medical decisions. Because many times within that 90 days, there is so many positive changes that can happen that can also eliminate need for major medical intervention. So, Dr. Wallach, I see that you are back.
Yes, ma'am. Can you hear me?
I can hear you great. Now, what do you have the bottle of? Oh, the plant-derived minerals. There you go. That's the one I take. Now, just kind of another public service announcement. Take it fast. It's a little bit astringent, but man, it gives energy. And I just love how I feel when I take it. But I do mix it with the Z Radical, and that's just very enjoyable. I have it twice a day.
Well, the Z Radical is very interesting. It's actually made from 8 or 9 different seaweeds and sea plants and kelp and all that kind of stuff. All those minerals from the sea is in the Z Radical.
But it doesn't taste fishy. It doesn't even taste salty. It's yummy. I love it. Well, Dr. Wallach, we have some questions here in the chat. Let's go ahead and address a couple of them. Okay. And Ronette would like to know, one, what is your approach to cancer and diabetes? Now, I don't know if this is with the same person or just 2 individual situations.
Okay. Well, diabetes is a very simple nutritional deficiency disease. Any one of 2, could be 1 or 2 nutrients, okay, deficient will result in type 2 diabetes. It makes up 98% of the diabetic population. Type 1 diabetics are ones where the kids are born with it, okay, because mama was missing something when the islets of Langerhans were forming in the pancreas of the embryo, and maybe only made 6 of the cells in the islet of Langerhans, okay, to make the insulin instead of 6,000. Okay, so the baby is born without enough insulin, and that's type 1 diabetes. Maybe 1.5% of the people with diabetes have type 1. I love it when doctors say, or people call me up and say, yeah, I'm 65 years old. My doctor just diagnosed me with type 1 diabetes. Well, you need to change doctors because the doctor's either ignorant or a crook, okay? When you have type 1 diabetes, you're born with it, okay? When you're 65 years old and the doctor says you have type 1 diabetes, that means he gave you an oral type of insulin, okay? And by giving you that oral insulin, he knows you've been eating gluten and your intestines are dead, so you cannot absorb, okay, this medication, okay? And then you can't absorb the medication. So he said, well, you got type 1 diabetes, you'll be on insulin for the rest of your life. No. Okay. If you're 65 years old and you're developing diabetes, the odds are 99.99999% of the time it's going to be type 2. And so this is where we have the healthy blood sugar pack, okay, which is our healthy start pack with the sweeties. When you get per 100 pounds of body weight, you want to take 3 sweeties twice a day. And then if you're on medication for diabetes, don't cold turkey off of that, but as your blood sugar begins to improve, you can slowly reduce the medication. And usually within 2 to 6 weeks, you'll be off the medication, you'll be an ex-diabetic. Now, how long do you have to stay on the 90 essential nutrients with the sweeties. Well, how long do you need oxygen? How long do you need water? Forever. Okay, otherwise it'll come back, and the second time you may not survive. Okay, an experience with, quote, type 1 diabetes at age 65. So I hope that helps answer that question.
So Dr. Wallach, I know for myself, I had a condition, and John T, can I mention conditions? It was a blood sugar issue, okay, that I didn't even know existed. Is it not technically diabetes, as you were just talking about, but it was a blood sugar issue. And I started taking the sweeties, and that in itself really helped with controlling my emotions. Also.
Well, a lot of times people get what's called reactive hypoglycemia. If you eat a big meal, particularly with carbohydrates in it, like rice and potatoes and beans and stuff like that, you'll release a lot of insulin. It knocks your blood sugar down so low, you can either get crazy or go to sleep, okay, or get crazy just before you go to sleep, okay? And so it's called reactive hypoglycemia. That's also the same deficiency that causes type 2 diabetes, but you get a little different sort of clinical thing going on, because when you release all that insulin trying to solve the problem, it knocks your blood sugar down so rapidly that your body thinks that you don't have enough blood sugar.
Well, and so something else that a lot of people don't realize is when you have a lot of blood sugar in your blood, it converts to fat. And I found that being one of the reasons why I wasn't able to lose weight. So when I got that blood sugar under control, I was able to start losing weight more.
Well, there you go.
So let's go to the big C, Dr. Wallach. Now, okay. I know that there's been a lot of research linking cancer with mineral deficiencies.
Well, mineral deficiencies result in a low immune system. Your immune system depends an enormous amount on minerals because your immune system is in your bone marrow. And so this is why I like the collagen peptides so much. This is why I like the Beyond OsteoFX so much. This is why I like vitamin D3 so much, because when you give your bone marrow what it needs, your immune system is working at top peak efficiency and helps defend against many, many things, including cancer. Cancer is caused by inflammation of the cells in every tissue in the body that make new cells. And when they get overstimulated, okay, with these sort of unusual chemicals, so to speak, it can be from industry or it could be just something that's going on in your body because you're eating a lot of fried foods, that kind of stuff. Or it could be, again, working around chemicals. And this is where a hair analysis will help. You get a hair analysis, so you can see if you have bad chemicals in your body, which if you have cancer, you want to get rid of the bad chemicals. You just can't, well, I'm eating well and I'm taking antioxidants. Well, did you get rid of all the bad chemicals in your body? Well, how do I know bad chemicals? Well, did you do a hair analysis? No. Well, anybody who's been diagnosed with cancer, you better get a hair analysis. Okay, again, get that book, Rare Earths and Cures, and get the hair analysis before you get cancer. And then you can reduce the risk of cancer significantly by giving your body what it needs and staying away from the bad stuff. And the odds of getting cancer is reduced significantly. But if you're just doing all the bad stuff and not doing much of the good stuff, the risk of cancer goes up significantly. Okay, right. I hope that helps.
That helps a lot, Dr. Wallach. And I'm glad that you have your hand up because you have the next question in the chat that I am going to address. And Dr. Wallach, poor circulation, peripheral nerve pain, muscle soreness, anxieties, 68 years old, 5'4", 125 pounds. And Anne is available to answer any questions for you.
Okay. So poor circulation, is that correct?
Yes.
That's what she has.
Anxiety.
Not a lot, but a few.
Okay. And then 125 pounds. Do you have any high blood pressure or diabetes?
No.
Okay. Do you have any back problems or knee problems or hip problems?
Leg problems, lower extremities.
Okay. Now, is it in the joints or the whole leg or what?
I would say like above the ankle. Sometimes I had peripheral pains.
Mm-hmm.
And let me say, you have answered a lot of the things that I need to look into. You have already mentioned that. Say, for instance, I think go with the hair analysis just to see where I'm standing.
Mm-hmm. Okay, good. Yeah, everybody should have a hair analysis every year, especially if you're still working or traveling. You need to have a hair analysis every year because you get contaminated once on an airplane, once on a bus, once going through a store. If they've, changed sprays on their lawn out in front. I mean, who knows where you're going to get, contact with something bad, but it'll show up.
I never had one, so I think that's where I should start.
If you've never had one, you need to get one.
Exactly.
Get the book, Rare Earth Spin Cures, and again, see, Rebecca's going to give out her little thing where you can get the book, the Rare Earth Spin Cures. Why don't you give that out now, Rebecca?
If you go to AskDocLive.com, you're going to click on Dr. Wallach's books, and you'll find Rare Earths Forbidden Cures there. Okay,
well, there you go. Okay, 125 pounds. Let's see here. Poor circulation, leg issues.
One more quick question.
Okay, you'll have to speak up better because I can't understand what you're saying.
Like I said, I think you've answered a lot of things that I need to look into. The only thing, and maybe that's why I have problems with, I have a feeling I have problem with fatty acid. How do I know my fatty acids are being absorbed or digested? That was one thing. And does those books cover food combinations? Because I think a lot of times we just don't know what we should combine food with and eating, this sort of thing.
Sure. Okay. Well, essential fatty acids, you do need a blood test. Okay. And tell the doctor, I'm particularly interested in my essential fatty acids. And so they'll make sure that they give you that piece of information. Normally, they just give you your red blood cell count and your hemoglobin and all that kind of stuff. But with a blood test, a standard blood test, you can find out how your fatty acids are doing, okay?
Yes, thank you. And your book covers the food combinations, how you should combine this and don't combine that with that.
And Rare Earth Spin Cures, that's a big one.
Okay. Thank you.
Well,
okay.
and you want to get a hold of Dr. Wallach's Good Foods, Bad Foods list. Take the bad foods out, focus on the good foods, and you don't have to worry about food combinations.
What book is that in the Rare Earth too?
Well, you can also get it on our website on Ask Doc Live. You can get Dr. Wallach's Good Foods, Bad Foods list.
And Hell's Kitchen.
And Hell's Kitchen.
Okay.
Okay, let's go to the next one. Thank you, Ann.
All right. Thank you, Ann.
Thank you.
Dr. Wallach, let's go to John, who has his hand up. John, go ahead and unmute yourself. You are on with Dr. Wallach.
Top of the morning, Doc.
Yes, sir. What's up?
I'm calling just to give you an account of my progress.
Okay.
I've been on the program for the 90 days, 3 months, as you said that at that point should start looking for good, some good progress. When I started, I had a pain in my hip. Spoke to a friend who had a hip replacement. He told me that's the exact pain he felt. That pain is completely gone, totally and completely. I do understand that, and I appreciate what's going on because my goal is to be part of the blue zone. So I'm looking to stay with your products. I realize that your products are formulated to work with each other. That your what you call your secret sauces, and I realize the value of your minerals. And it's and if I couldn't afford it, I would get my family. I would tell them, look, if what you can get me for Christmas, my birthday, is you you support me in my
journey,
in this process, and I'll be responsible to you that I conform. So we can always do it. I did want to tell you that I have submitted a hair analysis, which I'm waiting for. You know, you'd mentioned this, and I agree totally that way I will know if I'm getting the minerals from the product. If I'm not, that probably means that the stomach acids are not enough to break it down. I also recall you talking about the taking salt. So I take a half a teaspoon of salt in the morning. I believe you said to take it in the morning and the evening. I've only done it in the morning to this point.
Again, you know, if you're going to use salt, which everybody should, use our pink Himalayan salt. It has 78 minerals in it, and it includes the sodium chloride. Okay, it's made from, as the name implies, the pink Himalayan salt. It came from the oceans back when there were still oceans in the Himalayan mountains, which when the oceans went away, all the minerals in the water just settled in one place, and we got that as our salt source. Okay, 78 minerals plus sodium chloride. And that's what I take. I take a half a teaspoon at breakfast, half a teaspoon at dinner of my, and I have witnesses that I take it faithfully every day. Okay. And I'm 83 years old, and most people think I'm in my 50s when they look at me.
Does the Himalayan salt have the iodine in it?
Oh, yes, absolutely.
Because I know
it makes your thyroid happy.
I know also you need the iodine to basically help you to make the stomach acid.
Well, not only stomach acid, but also your thyroid requires iodine.
Right. I am taking Himalayan salt because I heard that part of what you told me to, and I'm only taking a half a teaspoon in the morning. And now I know a lot of people and me also myself, they're concerned. They've always been told that too much salt will hurt you. Now I understand that as long as you're drinking water with it, it will help to get the excess out.
Well, you have to appreciate that medical doctors don't know anything about salt. Okay, and they make a lot of mistakes by telling people to restrict salt. They made the mistake starting at the year 1900 when people started getting high blood pressure when they went from wood and coal as fuel to electricity. And they blamed hypertension, high blood pressure on salt. And so they told everybody to get off of salt, and it helped relieve blood pressure, but it also caused all kinds of nutritional deficiencies, about 45 new diseases they'd never seen before. And so they made a huge mistake by telling people to stay away from salt because salt causes high blood pressure. That is absolutely nonsense.
Appreciate that. I will add the half a tablespoon of salt starting today.
Half a teaspoon, twice a day.
Of course, sorry, excuse me, yes. I'm doing it in the morning, I'll start doing it in the evening now.
Yeah, and use ours. Use our pink Himalayan salt. Okay, it has the salt in it plus 78 minerals.
I will pick your salt up, on my next order.
There you go.
And like I say, I appreciate that all your products are formulated to work with
each other.
Exactly, sir. And I did have one other. I also wanted to bring up something that I hadn't realized until I heard it, and I did do a little research that it's like fructose corn syrup also will cause leaky gut. As far as so that's
okay. Well, any source of sugar gets converted to fat.
Right.
Okay, and so you get foods that have a lot of corn syrup in them because kids like it when it tastes sweet and so on. And so you want to read labels very carefully, okay, and stay away from as much as you can from that kind of stuff because it will convert to fat.
Understood. I do appreciate it. One other thing, and then I'll leave because I don't want to take up any more of your time and for other people also is, okay, Halloween's coming up, and I was thinking maybe the parents of the kids maybe they can bargain with them that they can go out and collect all the candy they can, but they have to bring it back and basically maybe the parents will buy some gifts that they know the kids would like, and they'll say, okay, you give me your candy, I'll give you this.
Okay, well, basically the kids will like the mineral sticks
Yeah.
Okay.
Yeah.
They will like the mineral sticks. They taste good, taste like cherries. They have 78 minerals in there, including collagen peptides. We have the Rebound sports drink with 100 nutrients in it. Most sports drinks are just energy drinks. They have caffeine and sugar. They don't have much in the way of anything else. Our Rebound has 75 minerals and 25 vitamins, amino acids. Okay, it comes in a canister, 36 servings, comes in a box and with sticks, 30 servings. The cans is 12 cans in a case, but you have to pop the top at night, put them in the refrigerator. They'll off-gas the carbonation at night, and in the morning it'll be flat, no fizz or buzz because it off-gassed all the carbonation. And I'll drink a half a can of the Rebound with my breakfast and with my my healthy, let's see here, my healthy bone and joint, my healthy bone and joint pack. Okay, my healthy brain and heart pack and all the tangy tangerine, all that kind of stuff. Okay, and so it's one of those things where you have to take, the whole schlemiel, as they say, the whole gamish, and it makes a huge difference.
I do appreciate it. Yes, I am taking your Rebound. I open the can and it just smells so fantastic. And when my energy levels are down, I do that. Doctor, I'm not going to hold you up any longer. I'm so glad you're here. I celebrate you today.
Well, thank you. You're very kind. And of course, you're asking questions that many other people would ask if they had the time or the energy or whatever. And so as they're driving or maybe cleaning house or at work, they're hearing you ask the question. Oh, I'd like to ask that question. And so you're asking some universal questions. And so I'm giving universal answers. And so it's not certainly a waste of time. And so we appreciate all that you do, because you're going to be a great example for a lot of people. Okay. And we thank you for your interest, and thank you. Give us a report in 2 weeks and 4 weeks and 6 weeks, because people are going to want to know whatever happened to that John guy, asking all those questions. And so they want to hear from you and see your results.
You have a kind heart, sir. I'll let you go now.
Okay. God bless.
Thank you, John. We appreciate you very much. And Kids Sprinkles, Doc. If you're not wanting to give out candy, Kids Sprinkles are going to be back in stock very soon. You can give out the individual little pouches that you just throw in instead of candy, and they taste great. My granddaughters absolutely love them. In fact, I would come over and they're like, Nana, do you have my sprinkles? And they were always, headed for the purse. So Kids Sprinkles are fantastic. They taste and they remind me of like Pop Rocks, except for without all of the sugar, of course. They are watermelon flavored, and they dissolve in your mouth, and it's vitamins and minerals, and they taste sweet and great. So just an option there. Now we have somebody, go ahead.
I was going to say, I like to put the Kids Sprinkles on gluten-free ice cream.
I like to put on my Greek yogurt, Dr. Wallach. My unflavored Greek yogurt, put Kids Sprinkles over the top, adds a nice little sweetness without being loaded with sugar.
There you go.
So yes, I'm going to do that more often also. Now, somebody has a question in here, because I love the fact, again, that we have so many products. If something gets on back order because of the supply chain, we have alternatives. And one of those is Glucogel. Now, with Glucogel, we have capsules, we have liquid. I actually take the liquid every morning, and then I have my capsules with my meals. So there's multiple options in getting the Glucogel, but that's also collagen, right, Dr. Wallach?
Yes, well, Glucogel was the first collagen we used when we made the Healthy Bone and Joint Pack, okay, for Theo Ratliff, okay, Glucogel. And I take 5 of those capsules twice a day, in addition to the collagen peptides. And okay, so because I do so much physical stuff that I want that extra collagen, okay, the Glucogel are very, very, as you say, it comes in liquid or the capsules. But I travel so much, I take the capsules. I can't be taking 18 different parts of liquids with me and so forth. So I tend to take the capsules and powders and tablets and that kind of stuff because they're much lighter and I don't have big troubles getting through
I can imagine your suitcases being heavy enough without having those liquids. Just throwing that out there. I know how heavy mine are when I travel, and I put my bottles of supplements and powders in there. It's, yeah. So back to, and we mentioned a little bit about thyroid and iodine. Lester has the question, is it possible to get off thyroid medicine?
The answer is, of course. Okay. Thyroid medicine was invented because doctors don't believe in salt. Okay. Your thyroid requires iodine as one of the 90 essential nutrients the thyroid gland needs. It doesn't just require iodine only, but iodine is very specifically for thyroid function. And so this is where our pink Himalayan salt comes in. Okay. But also we have Ocean's Gold. Okay. I like to take 3 of those twice a day. So I'm getting the stuff that I need to make my thyroid happy, including iodine, with the Ocean's Gold, because it's made out of 8 different seaweeds and that kind of stuff. Okay. And the collagen, and I know you like the Z Radical, okay, which is 8 or 9 or 10 different seaweeds, and that is seaweeds and kelp and algae and all that kind of stuff, has all these minerals in there. And so it's one of those things where you have to take care of the thyroid gland just like you take care of everything else. And so that's why we talk about the 90 essential nutrients, okay? And that's why I don't like to talk about one nutrient, because people, they go to the grocery store and they buy salt, some white salt in a canister with iodine added. So it'll be sodium chloride and iodine. So that's 3 nutrients. Well, our pink Himalayan salt has, our pink Himalayan salt has over 100 nutrients in it. Okay. And so it's 100 more than 3, of course.
Yes.
And so it's not only for your thyroid, but it's also for your bones and your liver and your heart and your brain and your eyes and your kidneys and your arteries and your muscles and your bones and your cartilage and your skin and so on. And so you're much better off doing the whole thing as opposed to just trying to pick and choose which one you're going to take. And that's why, again, I like the book Rare Earths and Cures, because you learn how to do a hair analysis. And if you do it once a year, that's about perfect timing, unless you work for some company that deals a lot with chemicals and you want to make sure you're not accumulating all these poison chemicals, and you want to do a hair analysis like once every 3 months. But usually once a year is good enough for a hair analysis for the average person.
All right. And also, while we're talking about this thyroid, Dr. Wallach, I used to wear like tall necked shirts to hide the double chin. And now I don't have it. And it was a swollen, what do they call that? Goiter?
Goiter. Hmm?
Yeah. And so I used, my high necked shirts, and in Phoenix, it got pretty warm. I couldn't wear scarves, but now I love scarves just for a pop of color. So it's amazing what happens when you give your body what it needs. And chemicals are not.
Well, you're a perfect example. You're a perfect example of what you get when you do everything right. I mean, you are a classic example of an American woman.
You're so sweet. And I still have some ways to go, but I am so grateful, so thankful for my journey. Because even though I got really low on my journey and I was in really bad shape, the fact that I was able to find something, Dr. Wallach, and put your research to action within myself. I mean, I didn't even know this was a business when I started. And now I've been able to help people help people.
Well, now you're helping thousands.
And I love it. I absolutely love it. But it's not about me. It's about making sure people have the information that they can use to help themselves in writing the journey that they want, that does allow them to enjoy life further into the years. So I'm very blessed, Doc, and to be able to host your show and
Well,
have
thank you.
you.
Well, we're blessed to have you as a partner.
Well, thank you, Dr. Wallach. Rhonda has a question. She wants to know, can asbestos be removed from lungs?
Okay, I didn't catch that. Can what?
Asbestos?
Oh. Okay, well, that's very difficult because asbestos, usually if you get it in your lungs, you got powder. Okay, you can compensate for it. Okay, by getting the inflammation down, getting more oxygen. And so compensating for it being there, if you have too much asbestos in your lungs, you might have to get a lung transplant. Okay. Okay. So you want to get 2 or 3 different opinions from 2 or 3 different pulmonologists to see where you're at. Okay. If you're not at the place where they're even talking about a lung transplant, you want to reduce the inflammation. This is again where collagen peptides would help. Okay, and blood flow, Ultimate Daily Classic tablets and Synaptive and mineral sticks and Rebound and all those kind of things will help with circulation and getting all the nutrients necessary for reducing inflammation in the lungs. We have Oxybody, a great source of oxygen.
Yeah, I was just going to ask, what about Oxybody? I know that has helped a lot of people with lung issues, whether it's just, cumbersome breathing, whether it's congestion.
It doesn't matter if you're a kid with asthma or a grandma with fibrous lung disease. Oxybody is a good thing to put in with your program. Absolutely.
Awesome. Well, Dr. Wallach, we've got a couple more hands up. Robert, go ahead and unmute yourself. Welcome to Ask Doc Live.
Dr. Wallach, interesting experience. My gastroenterologist suggested my fatigue would relate to an overgrowth of bacteria in the small intestine. So I did some research. I went out in my yard. I ate Oregon grape berries, and my fatigue has gone away over the last week. I'm wondering, would you agree that this could be bacterial overgrowth, and where would those?
Well, I would relate that to a science called crapola. I know you have certain mineral deficiencies because you have white hair. That's not caused by age, it's caused by mineral deficiencies.
Genetics in me.
No, it's not genetic. It's a nutritional deficiency. You do what I tell you, within 3 months' time, your hair will be your original color, whether it's black or brown or red or blonde, your hair color will come back because this is not an age thing. This is a nutritional deficiency thing. Okay. And how much do you weigh, Robert?
168.
Okay. Do you have any joint problems?
Back stiffness.
Okay. Do you have any ringing in your ears?
Yes, definitely.
Tinnitus? Okay. Do you have any balance problems or vertigo?
No.
Okay. Do you have any dental problems? Do you have implants or?
No implants.
Okay. Do you have false teeth?
Do I have what?
False teeth.
Oh, false no. Real teeth.
Okay. You don't have any of that. Okay. You have all your own teeth. Okay, good. All right. Do you have any, did you have any Bell's palsy or trigeminal neuralgia?
No.
Okay. Do you have anything going on south of your neck? Do you have anything going on with your hands? Any tingling or numbness in your hands?
No.
Okay, good. Okay, yeah. Okay, you have very typical peripheral neuropathies where you have tinnitus or ringing in the ears. This is a squeezing of the auditory branch of the eighth cranial nerve by osteoporosis of the skull. I want you to get a hold of the book and the CD set. Rebecca and I did the CD as a sort of a supplement and add-on to the book. It's all in your head. The subtitle on the CD is How to Prevent and Fix Osteoporosis of the Skull and MS, multiple sclerosis. And when we reprint this, it's also going to say Alzheimer's disease. But there's, I used to think there's 25 different diseases you could get when you get osteoporosis of the skull, but it's actually 37. And one of those, of course, is white, gray, and silver hair. Okay, one of those 37 is white, gray, and silver hair. These are nutritional deficiencies, okay, that go along with osteoporosis of the skull. And so your skull is squeezing the spinal cord. Okay, and that's why you're having stuff, you know, lower down in your back and your legs and so forth. Okay, and so, and you weigh 168 pounds. Okay, and so what I would do is 168 pounds, get rid of all the bad stuff, no fried foods, no processed meats, no oils, no glutens, no wheat, no bar, rye, no sugar, no carbonated drinks. Even the diet one's got to go, because carbonation neutralizes stomach acid, which is required to absorb minerals and digest food. And then I want you to take 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month. There's 215 nutrients in each healthy brain and heart pack, at the core of which is the 90 essential nutrients, the healthy start pack. Take 2 of those per month. That's a full dose twice a day. I do that, and I only weigh 142. And I want you to take, let's see here, one of our canisters of collagen peptides. You can take a scoop of that in your morning drink, a scoop of that in your evening drink. I also want you to take our MSM, get 2 bottles of our MSM a month. So you can take 3 at breakfast, 3 at lunch, 3 at dinner time. And they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, rakes, bone itself, including the skull. And you'll be amazed at the benefit you're going to get there from that MSM. And then vitamin D3, 2 bottles of that. So you can take 3 twice a day. That's 2 bottles a month of vitamin D3. And let's see here. Anything else, Rebecca, we should have Robert take?
I think you covered it all, Doc.
Okay, well, if you're going to drink something for energy, don't forget a Rebound. Okay, a Rebound, you can have a snack with our mineral sticks. And if you have anything going on with memory, do you have any memory issues, Robert?
Remembering names, but I'm not sure.
Remembering names a little bit? Okay. Well, I would also get our Synaptive. Get 1 bottle of Synaptive a month. So you can take 3 of those a day, so 1 with each meal. If you have a real serious problem with memory or brain function, you could get 2 bottles of Synaptive, take 3 of those twice a day. And I have more compliments on that one product in the last year than any other product, Synaptive, because people, you know, were told by their doctors, well, you're getting old, you got to expect to, you know, have all these problems, nothing you can do about it. And then they get on the Synaptive, and in 2 weeks' time, all their brain problems are gone. And they go back to their doctor and it's an amazing thing. Okay.
All right. Thank you, Robert.
Got it. Thanks, Doc.
You bet.
Okay, let's move right back over to, well, actually, there's a question here. So CJ has a customer who was exposed to carbon monoxide, Dr. Wallach, said that her level was at 50. She was taken to ER and then sent home. What can be done to help, you know, bounce back from carbon monoxide poisoning?
Okay, do we have any other information on her? How much she weighs? Any other?
We don't have any other information.
Okay. Well, let's go, say, for woman, adult woman, say 120 to 140 pounds. I want her to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no gluten, no wheat, bar, rye, no sugar, no carbonated drinks. Even the diet one's got to go. I want her to take 1 healthy brain and heart pack per month. Okay, a half a dose of everything twice a day. 1 bottle of our MSM per month. Take 3 twice a day. That's going to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone, mixed bone itself. I also want her to take vitamin D3, 3 of those twice a day. That's 2 bottles a month. I want her, let's see here, to take our Oxybody, which we just talked about. She get 2 quarts of the Oxybody a month, so she can take 1 ounce twice a day. Since she has exposure and damage from carbon monoxide, I'd have her take 1 ounce of the Oxybody twice a day, ounce in the morning, ounce in the evening. I wouldn't take it right before bedtime. I would take it maybe an hour before bedtime, maybe a half hour before a meal or something like that in the evening. I like the Oxybody just for the energy, get that oxygen. You know, at 83 years old, I like the oxygen. I've been taking it for 25 years. It works for me.
All right. And Dr. Wallach, CJ has another question. Her brother is 68 years old. And sorry, CJ, I don't know if you're female or male, but brother is 68 years old. 6 feet tall, 147 pounds, so tall and thin. He was on a cruise and had a mishap with his left foot. His knee was extremely swollen, taken to ER, and they inserted a needle and drew fluids from his knee. Thereafter, he was placed on some heavy steroids, antibiotics, which literally sucked out all of his muscle mass. His knee gets extremely swollen and painful after physical therapy, but at night the swelling goes down. What would you recommend for CJ's brother, Dr. Wallach?
Okay, to 147 pounds with this issue, get rid of all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, butter, and oats, no sugar, no carbonated drinks. Even the diet one's got to go. 2 healthy brain and heart packs per month, a full dose of everything twice a day. 2 bottles of the MSM per month, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes bone itself, including in the knee and the vertebrae in the back and the skull. And you say 68 years old, wouldn't hurt to get the book and the CD set. It's all in your head. Again, 37 different diseases, including trauma, either trauma or just degenerative disease of the knees and the hips and the ankles and the shoulders and vertebrae and all that kind of stuff. They can rebuild, even if you're 68 years old. Your body can rebuild them when you give them your body the raw materials. Then vitamin D3, 3 of those twice a day, 2 bottles a month. And just to take with you in your pocket in case you want a quick snack, energy snack or something, don't get a soft drink. Just get a bottle of plain water, not carbonated water, but plain water, and carry these mineral sticks with you and pop 1 or 2 of those into, a bottle of water. And if you're going to take a Rebound, we have the canisters, we have the sticks, and we do have the cans, but the cans, you want to pop the tops on them in the evening, put them in the refrigerator so they'll be flat in the morning. We don't want the carbonation in the cans of carbonated Rebound. But the knee thing should certainly be significantly improved or totally go away. But this is going to be a lifelong effort, because how long do you need oxygen? Forever. How long do you need the 90 essential nutrients? Forever. How long do you need water? Forever. And so the same thing is true here. When you have some kind of issue, the need for a little special attention to those kinds of issues never quite totally goes away. Okay.
Well, and Dr. Wallach, people are asking, Doc's saying a snack and to drink something, and it's not a protein drink. But one thing that I found, my cravings came from mineral deficiencies. When I started giving my body the minerals that it was needing, it was satisfied longer. And John had mentioned fructose, corn fructose syrup, or fructose corn syrup. There you go.
The answer is no. Got to stay away from it.
No to corn fructose corn syrup, because it's like it flips a switch. You eat food with it and you just don't get satisfied. And with the mineral sticks or the Rebound, it is very satisfying because you're giving your body things that it needs and that it's wanting. So
there's actually a behavior, okay? When you're missing minerals, there's a behavior that makes you get fat. What's that behavior called, Rebecca?
Well, my horses would do it, and it's called cribbing.
It's called cribbing for horses. It's called cribbing for babies because they chew on the crib rail. But for everybody else, it's called pica. P-I-C-A, okay, pica. And this is what causes people to gain weight. You're missing minerals, which drives you to look for the minerals, so you're eating everything. And it's the excess eating because of mineral deficiencies producing this pica. And this is why you take your minerals that you're supposed to. You take your 90 essential nutrients, and we do have a keto drink, okay, keto shake, okay, 1 meal a day. It's not to add to a meal. It's a meal replacer. Comes in strawberry or chocolate, and you'll lose a half a pound to 2 pounds a day taking your 90 essential nutrients and that keto shake 1 meal a day. It's a meal replacer, not to add to a meal. And so it's one of those things. Look up the word pica, P-I-C-A, in any dictionary. It'll just say an obsessive behavior to eat. Okay, and of course in horses it's called cribbing, and they named it after the baby's habits of eating the rail on the crib when they're minerally deficient. When the mother was eating gluten and the breast milk didn't have everything in it, so the baby would chew on the rib or the rail on the crib, so they called it cribbing.
All right, thank you for that, Dr. Wallach. And let's go to Rhonda, who has her hand up. Rhonda, go ahead and unmute yourself. you had another question?
Hi, yes, thank you. My cousin has a son. He's a chiropractor. He's middle-aged. I do not know his exact age, but he's in overall very excellent health. They practice. He already uses a lot of supplements, does the organic, you know, he eats and does as best as you can. And it has been overall in good health, but he's had two major issues, serious issues come up. They recently diagnosed him with Coats disease. He is losing vision in his right eye. And they said he'll eventually lose it all. And then the other issue they've just told him about is he has Crohn's disease.
Okay, well, Crohn's disease is a bowel problem. It goes along with irritable bowel syndrome and celiac disease and all that kind of stuff. That's a gluten issue. And that's why he has a vision problem. The odds are, do you know how old this guy is?
He's middle-aged. He has young children, like 9,
so
10,
he could be,
you know?
okay, so he could be 35 to 50.
Yeah, I would guess 40-ish maybe, somewhere.
Okay, yeah.
Not 50,
all right.
not
okay.
50.
Okay, but at any rate, yeah, he's got osteoporosis of the skull, squeezing the optic nerve, the optic artery, the optic vein. And that's why he's slowly losing his vision because the skull is squeezing that. The best present you can give him is some Healthy Brain and Heart Pack, the book and the CD set. It's all in your head. He also needs to get the collagen peptides, MSM, vitamin D3. And, you know, just getting vitamins and minerals is better than nothing. But when somebody tells me they're taking vitamins and minerals, are they taking, you know, a vitamin mineral product that has 4 vitamins and 2 minerals in it? You know, what does that mean? You know, in 150 pound.
I know as a doctor, he prescribes nutrients.
Well, that doesn't mean anything.
I understand. How do I explain that or share with him as a doctor?
Well, let's do a 3-way conversation. You know, let's talk with him directly.
Okay, that would be awesome because he's a very, very good chiropractor.
Good. Let's talk. Well, it's good. He was a good chiropractor. Let's talk with him. And
very health conscious.
Okay, let's get, are you a Youngevity associate?
I'm a distributor. Okay,
great. Then you can, you know, say, okay, look, let's get you and Rebecca and Doc on the phone here. And he doesn't have to do it on the air, so people don't have to hear the conversation. We can do it off the air, so it's just the 4 of us, okay?
Awesome. Okay, that would be great. I'm gonna share this video with his daughter as soon as it's up. And I believe he may already be gluten-free. Is it possible you can be gluten-free and still have these troubles?
Well, if you get Crohn's disease, it's a gluten issue. Okay, now he could have stopped taking gluten a year ago, but still have Crohn's disease because he's damaged himself.
Okay.
And a lot of people, his family may have been still eating gluten, and he's getting cross-contaminated in the washer and dryer.
Oh, him and his wife are both chiropractors, and they're super strict, from what I understand, about their diets.
Well, let's see.
So I'll give.
Well, a lot of times they'll eat oats and think there's no gluten in oats, and so oats are loaded with gluten. It's just called gliadin, and so he may be misinformed and eating oats. Okay, so we need to ask him questions instead of assume. You know what happens when you assume?
Yes, sir. Do you feel you can reverse the eye condition?
Well, if it's due to osteoporosis of the skull, yes. Okay. If it's related to the Crohn's disease, yes. Okay. So I need to speak to him a little more before I can, you know, just flatly say, yeah, we can fix it in 2 weeks, you know.
I understand. Well, I will definitely share our talk as soon as it's available, and hopefully y'all can connect soon.
Okay. Thank you and God bless.
It. Thank you, Rhonda.
Thanks, Becca. Love you guys.
Love you too. All right. So CJ has a follow-up to her brother who lost muscle mass and was having the knee issue after the fall. Wants to know how to rebuild muscle and create muscle mass.
Okay. It has to be get rid of all the bad stuff, maximize absorption. 2 healthy brain and heart packs a month, a full dose thing twice a day. Needs the collagen peptides. A scoop of that with a morning drink, scoop of the evening drink. MSM, 2 bottles a month. So you can take 3 at breakfast, 3 at lunch, 3 at dinner time. You need to not only make the muscle mass grow, but also the collagen and the tendons and ligaments and connective tissue and everything, including the bones. And I exercise. You know, I'm 83 years old, but I walk 3 miles a day. I walk a mile, then an hour or so later, I walk another mile, another hour or so later, I walk another mile. And so I get my mileage in. I get my 20 push-ups in twice a day. Okay, I'm in pretty good shape. I can take on a pretty big guy if I had to, okay, at my age, and still come out pretty good because, you know, I lettered in wrestling in high school and University of Missouri and football, okay. And so, I wrote the book Prepare along with Marvin Ropp and Dr. Milan. And so I spent 27 years in the military, and I think I could do okay, even at 83 years old.
All right, Dr. Wallach, thank you so much. We've got 2 hands up. Let's see if we can get in as much as we can here. So HF, go ahead. Oh, HF has popped off. Let's go to David. David, go ahead and unmute yourself. Welcome to Ask Doc Live. You're still muted, my friend. Not yet. Try again.
Yeah, let's call it a day.
Well, we had it for just a brief second, but it's like going in and out.
Let's call it a day.
All right. Well, I'm sorry, David. We can't get you unmuted here. Well, everybody, you have been listening to Ask Doc Live. Here, sponsored by AskDocLive.com. We encourage you to get back with the person that shared this program with you. Thank them for sharing this information with you. And folks, if you're listening to this and you are going through and thinking, oh, I know somebody with that. I know somebody with that. Or, you know, my loved one is dealing with this and that. Share this with them. We put this recording together. We make it available so that it can be shared. And we always encourage people to get back with the person that shared this information with them. If nobody shared the information with you specifically, you have never spoken to anybody within longevity about longevity or any of the longevity products, then use AskDocLive.com. Get in contact with us through the Contact Us option there on the website. There's also a store there that you can use to purchase products. And again, listen to the replays. Stop. Dr. Wallach, he speaks fast. Yes, he does. I've learned how to take really fast notes, but I've also learned how to listen fast. Use those replays to help you help yourself. I just want to thank my co-hosts, John T. McCollier, Nasima Omar, Ruth Ellen Sanchez, Heather Bowen, and Dr. Judy Reynolds. And you're like the grandfather of us all, Dr. Wallach, but you're not old enough to be my grandfather. So the father of us all, Dr. Joel Wallach, we thank you so much for taking time out of your busy schedule each and every Friday to join us here for these 2 hours. Everybody, be blessed. Give us 90 days, and we'll see you next time on Ask Doc Live.
Well, God bless you, and thank you so much, Rebecca, and to the team. God bless each and every one of you. God bless our watchers and listeners and viewers, and God bless America.
God bless the world, Dr. Wallach.
God bless the world.
International. We've got to be all encompassing.
God bless the world.
There we go. Bye for now, everybody.
Bye-bye.